Part 2, Exploring Soft Tissue Changes in Total Edentulism. In Part 1, we explored the anatomic consequences of total edentulism, alveolar bone resorption, changes in the occlusal plane, alterations in facial dimensions, and adaptations in speech and muscles. Part 2 delves into the soft tissue changes associated with the absence of natural teeth and their significant impact on oral health and aesthetics. Gingival and mucosal changes. The absence of teeth leads to changes in the gingival and mucosal tissues. The once supported gingival structures undergo atrophy and may exhibit recession. Understanding these changes is crucial for dental professionals involved in prosthetic rehabilitation, as they must account for the altered soft tissue contours when designing dentures or implants. 2. Loss of periodontal ligament, PDL, influence. The periodontal ligament, a fibrous tissue that connects the tooth root to the alveolar bone, plays a role in maintaining the health and vitality of the surrounding tissues. In total edentulism, the absence of the PDL removes its influence, contributing to further soft tissue changes. Clinicians must consider this loss when planning for implant placement or other restorative interventions. 3. Vestibular depth and muscle tone. The reduction in vertical dimension associated with total edentulism can result in changes to vestibular depth, the space between the lips and cheeks and the teeth. These alterations, along with changes in muscle tone, impact facial aesthetics and the overall support for prosthetic appliances. Proper assessment and management are essential to achieving both functional and aesthetic outcomes. 4. Speech articulation and lip support. Soft tissues, including the lips and cheeks, play a crucial role in speech articulation. The absence of teeth affects lip support, leading to changes in speech patterns and phonetics. Prosthetic rehabilitation should address these soft tissue considerations to enhance both the functional and aesthetic aspects of the patient's oral health. Conclusion. Part 2 has highlighted the intricate soft tissue changes associated with total edentulism, emphasizing their importance in prosthetic rehabilitation. Part 3 will further explore the aesthetic concerns arising from tooth loss and provide insights into addressing these challenges for comprehensive patient care.